there is an idea that actually the chances of getting flu are pretty slim for an average healthy person. However, the flu virus is really good at spreading from one person to another. So there is some research out there that suggests that actually you can be carrying the virus without actually showing any signs of infection. And if that's the case, having the flu vaccine would actually reduce that risk to other people. So for you, perhaps because you are healthy, you may not be showing signs of infection, but for somebody else who's a bit more vulnerable, then, you know, your virus that you're spreading around potentially could actually cause them to have a significant infection. And we're talking not just the elderly, but also the young, and also our client group within the learning disability field.
Okay. People think the likelihood of them getting flu is really quite low, but when you actually look at the statistics, particularly for healthcare workers, the likelihood of somebody working in a healthcare setting of getting flu is 1 in 4.
There is an argument that if you're healthy, then you're not likely to get an infection, and to some degree your immune system will protect you from infection. But as I've said before, the virus, you can be carrying the virus without actually showing any signs of infection. We did lose one of our team members a few years ago from flu, and she was a healthy young nurse, well, I say young, same age as me, and she got the flu virus, and within a very short period of time we lost her. And I think for me that really brought home how vulnerable we all are really to infection, even though most of the time we probably feel.
People think that if they're healthy then they're unlikely to catch flu. But actually when you do look through the data at the number of hospital admissions, 90% of those that admitted with flu were under 65.
Yeah.
Okay, there is an argument that if you haven't got flu or you don't show any signs of flu, then you're not a risk to others. But as I've said before, the virus is really good at moving from one person to another. The flu virus is well renowned for adapting to the situations that it finds itself in. So a little cough, little sneeze, and you could be spreading it across to somebody who is a bit more vulnerable to infection. And that's really what we're looking at. It's about protecting those that we have contact with who may not have such a good defence against it.
When we had the swine flu period within DCHS, we unfortunately did lose a member of the infection control team who was fit and healthy, did catch flu and did subsequently die of symptoms related to flu. So I would strongly encourage everybody that does have the opportunity to have the vaccine to take that and not even think twice about it, because if Joy was still with us, Joy would be actively encouraging that everybody did have the flu.
A lot of people have said to me that because it's not really that effective, why do we bother getting a vaccination? And it's to do with the fact that the more people who have the vaccination, the less people will have the severe symptoms of flu, which means you're not spreading as much of the virus around as you would do if you hadn't had the vaccine, if that makes sense. So vaccine is still the best prevention for flu. You know, it stops you getting the really heavy bug load that you would get if you didn't have the vaccine. So you're not spreading as much of the virus around as you would do if you hadn't had the vaccine.
Yeah. Influenza can affect people differently, so people can have different levels of symptoms, and often people don't realise that even the low level symptoms that you probably class as a bit like a cold, mild cold or slightly mild fever actually does put other people who are at risk. Yeah. Influenza for a lot of people can have actually really serious consequences, and the best protection we can offer our patients as healthcare workers is to actually have the vaccine ourselves. Because by doing that, we're actually protecting our patients as well as ourselves and our family.
Some people say they get side effects from the vaccine. You shouldn't do really, unless you're classing maybe getting some mild cold symptoms as side effects of the vaccine. And I've already explained that you know, that is a possibility. There used to be egg in the vaccine, so some people with that kind of allergy may get a bit of localised reaction, but you would know if you fell into that category. So if you do have a reaction, or you know that you've got an egg allergy, the best thing to do is to check it out with whoever's given you the vaccine, and have a conversation with them, or check it out with your GP and just get the right advice, because sometimes it's not actually the vaccine that's causing you the problem.
People commonly say to myself and the team that you get side effects from the flu vaccine. If you look at the evidence for where they've done placebo trials, with placebo should I say, and trials with the vaccine, there is actually no evidence to say that there are any significant side effects with the flu vaccine. And again, essentially it is a vaccine, it is no different to any of the other vaccines that we have as healthcare workers. There is no live strains used in the flu vaccine, so you can't actually get flu from it. And you know, the key thing about the flu vaccine is it is a vaccine that is looked at every year and updated to protect us as best as it possibly can, based on the strains that they're seeing across the world.
So why do I need it?
It's a good point that the vaccine isn't mandatory, so yeah, you can choose not to have it, and at the end of the day, that is your choice. I would just like to emphasise all the points that I've already made, really, in that the vaccine will stop you getting severe infection. It will prevent the spread of the virus from one person to another, because it will reduce in a large group the amount of virus that's out there circulating. And I think that's what we need to hang on to. It's to stop the complications, and it's to reduce the amount of that virus that is out there. And the more of us that have that vaccination, the more we will have that kind of impact. And that way we can protect anybody that we come into contact with within our workplace. Because it may not just be our patients and clients, it may actually be our work colleagues who are also vulnerable to infection. So we just need to think about that as well.
People often ask, why do they have to have the flu vaccine? It isn't mandatory. It's not something that we're forced to do. But as people working in a healthcare organisation and people who are working in professional roles looking after patients, I think it's our duty within our professional codes of conduct, whether we're unregistered or registered, to protect our patients the best we possibly can, and we should all be having the flu vaccine.